Hi, we are going to demonstrate emergency treatment. This is Oliver. This is Oliver. This is Udi, and I'm Sam. In our lives, we aren't familiar with emergency situations. But we can face it everywhere, including this room. By our demonstration, we will show you 3 situations you can handle in case of emergency. First, I'll take care of cardiopulmonary resuscitation. And second, Oliver will demonstrate Heimlich maneuver. And lastly, Udi will take care of first aid for fracture. As these procedures are not that hard, it is better for you guys to remember it well. Then let's begin. Cardiopulmonary resuscitation, also called as CPR in medical world. As this term is long to pronounce every time, I'll call in shortly CPR. CPR is the first aid when someone stops breathing or stops the heart pumping. Many people think that CPR is just massaging heart in order to pump again, but we should know that CPR is not just massaging heart. It is to press it by our hand directly to pump it again. To patients, after 4 minutes of it stops pumping, the patient's brain becomes malfunction unrecoverably. So we should start CPR at least 4 minutes after the patient's heart stops. First, what we should do is to stay next to the patient. Stay close to the patient and check if his symptom is on or off. After this procedure, if he is unconscious, we should call someone else close to you and tell the guy, call 119. Be careful, but you should tell a specific person to call 119 because the someone who were pointed by get the responsibility to call 119.
Hey, hello here, call 119.
After this procedure, come close to the patient and look at the patient carefully. The next thing you should do is tilt the head back. The reason for doing this procedure is to make the air come in and out more easily of the patient. After tilting the head back, you should tighten the nose and cover the mouth with your hands. Give 2 breaths. After this procedure, even if the patient is not breathing, we should start CPR right now. Fold hands together as this guy does. You should use the bottom place of this palm to press this patient's heart. But one thing you should keep in mind is that you should aim the right place. Many people think that heart is on our left side of the chest, but it is not. It's also in the center of the chest. So you should press the chest on this middle of the heart middle of the chest, 2 inches below the neck, and push the center of this chest 30 times. While doing this procedure, one thing that you should keep in mind is that your arm and the patient's chest must be 90 degrees. The reason for doing 90 degrees is that it is the most powerful and efficient way to press heart. If you're still doing CPR, even if the patient is still unconscious, you should do it until the emergency man comes and gets help. This is end of CPR.
Have you ever choked on food during meal? Maybe, or you have experienced it. It makes you suffer from breathing. Yes, it can lead people to death. So I would like to Heimlich maneuver to you. It is very important. You can save a patient with respiratory obstruction by taking these steps. But this is only for adult patients. First, when you find a person who is choking, you need to check his symptom. If he suffers from breathing, judge that his airway is blocked. Then, require someone to call 119. But you should pick a specific person.
Hey, yellow hair, call 119.
Second, it is time to start in earnest Heimlich maneuver. If he can cough for himself, induce that he coughs. After that, behind his back, make a fist and locate it, his navel and pin up the stomach. And place a thumb of the fist at his belly and grasp the fist with your another hand. Next, put on leg between his legs and straight another leg backward. And then press into his abdomen 5 times upward with your hands strongly. Finally, when you finish the process, you must repeat abdominal thrust step. It is important to perform continually until food comes out or emergency medical technicians arrive. But this step can cause the organ damage because it gives high pressure to abdomen. So the patient should go to a hospital and check whether the organs are damaged. And if the patient is a pregnant woman or a seriously obese person, you must press chest, not abdomen. After conducting this procedure, you will rescue many choking victims and will be blessed from them and their families.
Hi, I'm Udi. I describe first aid for fracture. Have you ever fallen or running in the park? While enjoying the spring weather, you spend a lot of time outdoors and there are many risks of injuries all around. Above all, the fracture is one of the risks of the injury. Fracture is often refers to the symptom of broken leg. However, you are difficulty to distinguish between the simple muscle ache and fracture. But wrong action when the broken bones is lead to chronic disease. Therefore, you should learn the symptom of fracture and first aid of fracture. The typical symptom of fracture is swelling in the injured area, and in case of broken legs, you are difficulty to put on weight on your foot. Then we'll describe at this time. We'll describe his broken legs. I will show you simple demonstration and tips of first aid for fracture. First, you don't unreachable to try to bring back his broken leg to its original state. This attempt can cause the legs and nerve damage in their fracture site. Second, you need to call a 119 rescue, and you can make a splint, use a wooden rod, and folded several layer of newspaper. I will show you simply demonstration of this. First, you tighten the fracture site, use such a bandage or towel. Second, you place the strap to tie the wooden rod is appropriately interval. Next, place the wooden rod next to fracture site. Finally, tie the wooden rod with strap. At this time, the important thing is that you don't tie strap on his fracture site directly. Next, you can state better condition. You can use ice pack. It can help your condition. Finally, if bleeding in your fracture site, you use clean cloth or gauze. It can make stop bleeding. If you have above first aid, you maintain the good condition before the alive rescue.
As we have shown these three situations, we showed CPR, Heimlich maneuver, and first aid in fracture. These procedures are not that hard to follow, so if you have any emergency situations close to you, do not panic, and remember these procedures and cure for your patients. Thank you. Do you have any questions for our presentation? Thank you for listening.